Let's talk about what pelvic floor PTs oftentimes refer to as your core canister. Imagine that your core is this container where you have the abdominal muscles in the front, the spinal stabilizers in the back, the diaphragm at the top, and the pelvic floor muscles at the bottom. It's important to be able to understand the relationship between your diaphragm and your pelvic floor to really grasp why breathing mechanics is so important to optimal pelvic health. So let's dive in. The diaphragm is this dome-shaped muscle that lies just underneath the rib cage, and it's stacked on top of the pelvic floor. So think of this like a sandwich where you have bread as the diaphragm, pelvic floor, and the abdominal organs is in between. The diaphragm and the pelvic floor function like a piston. So when the diaphragm descends, the pelvic floor lengthens downward, and when the diaphragm lifts, so does the pelvic floor. So when you take a breath in, the diaphragm descends downward, creating a vacuum to suck air into the lungs. In response to this downward pressure, the pelvic floor lengthens downward. When you exhale, the diaphragm moves back up to its resting position, and so does the pelvic floor muscles to their resting length. Without establishing this coordination and relationship, no amount of Kegels or core strengthening is going to help resolve your pelvic floor and core dysfunction. It truly is the foundation to your healing. So let's take a minute to practice. Sit up nice and tall with your feet flat on the floor, the crown of the head reaching up towards the ceiling. And now visualize the diaphragm sitting just below the ribs. Visualize the pelvic floor like a bowl at the bottom. As you inhale, imagine diaphragm moving down and the pelvic floor lengthening. As you exhale, imagine the diaphragm moving up and the pelvic floor lifting gently. As you inhale, imagine that diaphragm and pelvic floor both moving down. And as you exhale, imagine the diaphragm and pelvic floor both moving up. Try a few more breaths. So if you're not able to really visualize this and definitely can't feel it in your body just yet, that is totally okay. We'll come back to this concept again and again. We're just kind of starting to explore this relationship so that you have a better understanding of the inner workings of your body.